Back with an educational presentation and review of red light and near-infrared photobiomodulation therapy to prevent this top 17 contributing factors or risk factors for dementia. And actually, this is appropriate for other cognitive disease models as well. And so I decided to make this video for a couple reasons. One, my mother had suffered with dementia in the recent past, and two is that photobiomodulation, I deal with all various companies for maybe the last 10 years, and I find it to be an amazing treatment modality for so many different conditions and supporting so many different health goals. And there are a lot of other synergistic modalities as well, but I just thought I'd make this one just to point out how comprehensive photobiomodulation really is because of what it does on a cellular level and how it's so appropriate really in creating protocols and support for so many different conditions. So when you go through this presentation, and there is a download link below in the description along with my email address, you'll kind of see as you go through it how impressive it actually is for the top 17 contributing factors based on all the meta-analysis of many different studies related to dementia risks. And if you are impressed by that, just keep in mind that I could do a lot of these presentations for so many other diseases, health conditions, health goals, and it's going to be just as impressive and just as comprehensive because of really how photobiomodulation works in the body. Once you understand that, then it makes complete sense on kind of why it's helpful for just about anything. And there are a few other modalities that fall into that category, but not many that are so deeply systemically supportive. So this presentation, again, is below. You can download it, take a look, feel free to share, do whatever you want with it. And if you have questions about guidance on what type of photobiomodulation device, I deal with many different companies, all kinds of applications. Just reach out on my email anytime. This presentation is based on 5,000 studies, and that's photobiomodulation studies. So basically, they're conclusions of the studies that are appropriate and related to the 17 modifiable factors that contribute to dementia, stroke, late life depression. But again, this presentation is focused on dementia. But when you know the 17 factors, you kind of see that, oh, wait a minute, a lot of those are involved with so many other common health conditions. So as we kind of go through this presentation and you're like, wow, this is so great, just consider that, oh my gosh, yes, it is actually great for so many other conditions as well. So this is it's a crazy number and growing rapidly, but as of now, somewhere around 55 million currently living with dementia, expected to triple by 2050. I actually think it is going to quadruple or more when you kind of factor in a lot of other things. But whatever, either way, it's wildly increasing rapidly. 40% risk reduction is possible through lifestyle and behavioral changes, okay? And that does get into a little bit of incorporating photobiomodulation, okay, for your loved one or your patients, clients, or for yourself. So photobiomodulation does really offer promise for many of the different risk factors we'll talk about, okay? Here's a little excerpt from Harvard. And Harvard, by the way, there's a book, it's a little pricey, but there's a book you can buy on Amazon and elsewhere that goes into all the photobiomodulation studies and research for brain-related conditions, and also like the brain treatment photobiomodulation studies. So there's a really good Harvard medical book study on it. So they do a lot of research actually with photobiomodulation. His quote, "This study really shows how powerful lifestyle and behavioral changes are for age-related brain disease." Anyway, let's move on. So these are the 17 modifiable dementia risk factors, okay? And it does also include this, and there really are other conditions as well. But again, I'm pulling these 17 from some recent meta-analysis studies that ascertained that these were the main ones that would contribute to the risk of having dementia. So you can put pause on your screen. I'm not going to read all of them here, but you can kind of glance at them, take a look at them. And when you see all of these, absolutely, you know, your lifestyle, your diet, things like that, stress, right? That's all very important. Supplementation, of course, can be extremely helpful, but we won't really be getting into that. on this. But what I will say, I am a bit of a supplement genius in terms of obsessively studying supplements at least the last 15 years. There are some great ones out there in terms of what photobiomodulation does on a cellular level and a metabolic level. You can accomplish some similar effects with supplements, but you have to take multiple things, and it does start to add up, cost-wise, versus investing one time in some sort of a photobiomodulation device or equipment. And if you do want to do the supplementation approach, that can be amplified and improved in the efficacy of those supplements by combining it with photobiomodulation, as well as a few other modalities that have a systemic effect. So also just wanted to point that out as well. Certain modalities will amplify the effects of supplements. So we're actually going to get into how photobiomodulation is able to be related to, according to the studies, all of these factors, all of them. Pretty awesome, right? Okay, so what is photobiomodulation therapy? So if you don't know, you can obviously skip ahead a little bit here if you do know all about photobiomodulation here, okay? But it's a non-invasive treatment. It's usually using an LED or a laser, okay? And red wavelength, which is visible with your naked eye, 660 nanometers to 670. Within that range, actually starting from 630, is where most of the studies have been done. Near infrared's invisible to the naked eye, 810 to 850. There is also 940 and 980, and also 1020, 1060, whatever it is up there. Those also have been researched as well. A lot are in these ranges. And really, honestly, in the 900s range should really be mentioned. There's a lot in that range also. Okay, so photobiomodulation therapy describes the therapeutic potential of those lights to enhance healing mechanisms. Okay, and we call it a photochemical response because it starts as light photons, obviously, and the skin and the dermal layers have mitochondria, of course, right, inside the cells of the varying tissue types, and there is a certain window, like an optimal biological window, where there are certain peak wavelengths, like the ones we just mentioned, that are biologically or metabolically active. So there are little areas to receive those photons, those wavelengths, that is literally in the actual structure of cells and the interior structures like the mitochondria. So in other words, there's other wavelengths not mentioned, okay, because there's a lot more in the red and a lot more in the near infrared spectra that are really not as absorbable. They don't have that photochemical response that is quite as directly measurable or powerful. So if I just made up a random number like 2000 whatever, okay, nanometers, like that might do nothing really that is going to have a photochemical. By the way, I didn't define that, sorry. So photo is light, right? That's what that word means. And then chemical is just the reference that it's going to be creating all these transcription factors. It's going to alter gene transcription in the nucleus. That's going to alter then protein synthesis. And that's going to create a wide variety of different things, cell signaling that changes the environment, changes the external environment outside the cell, and then also inside the cell. So all of that is the chemical, biological, metabolic effects to the light or to the photons. Does that make sense? So we always say red light or near infrared, that has a photochemical response. Okay. And one thing to be mentioned is that in the studies, they found that even if you treat a localized area, because it's affecting mitochondria inside a wide variety of cells, and then this whole effect chain reaction happens, okay? There's a lot of compounds that are beneficial and a lot of different signals that are beneficial that go into the environment. And so it can actually, because you also have a circulatory system especially, it can go on and affect other areas beneficially of the body. Even if you do enough energy in a localized part of the body, it can have a systemic effect. So if you treat enough energy, I'm just going to say like in your leg or whatever, that'll actually still have some beneficial effects to your brain, for example, or even if you treated your foot, you'd still actually see some changes in the brain. The main way it reaches the brain so efficiently is because your circulatory system is very efficient between your foot and your brain, right? Your peripheral needs, and the brain receives a lot of blood because it has such a high ATP energy demand. So anyways, moving on. So the key applications of the effects of photobiomodulation is neuromodulation. So you can, in the studies, some people use the LEDs or lasers for direct brain application for cognitive enhancement, and near infrared is usually best for transcranial effects. If you do red, which is also still great, you can do it on the side, according to the Harvard studies and other additional, you can do it on the sides of the neck where the jugular is. It's great. They found actually on the gut works quite well also for affecting the brain, to not get into it. And then also the face, and then there's also some ones that you can put inside of the nose, and there's really only a couple companies that do that, right? BioLight's a trendy one that kind of was the first on the market to do that. The reason the nose works well with red is because you have a lot of fine capillaries. You ever have like a nosebleed and it just keeps bleeding and bleeding and bleeding, right? So basically what's happening inside the mitochondria in the capillary beds there of the nose, that goes on to affect the brain. Because obviously where that blood in your nose is going next is more efficiently to your brain more quickly versus like going to your toe on the bottom of your foot, right? So photobiomodulation also has systemic benefits, which I mentioned, due to circulation, metabolism, inflammation reduction. Also cellular health does a wide variety of things. Mitochondrial function, ATP production, reducing oxidative stress. Okay. And I'll just quickly say here that, because we already talked about it, the photons penetrate tissue. They're absorbed by cytochrome C oxidase in the mitochondria. Enhances ATP production and does some other things as well. Activates signaling pathways, increases blood flow. All that improves cellular functions, a wide variety of functions, and reduces not just neuroinflammation, but inflammation in general. Neuroinflammation is mentioned because this report or presentation is about dementia, right, and cognitive conditions. And this does support other conditions, by the way, but beyond dementia, just to be clear. Dementia tends to be very receptive to photobiomodulation because a lot of it, not all of it, but a lot of it is mainly related to the vascular system of the body. And so, yeah. All right. So the key science, we talked about the light absorption, cytochrome C oxidase. That's basically the molecule compound that's most involved in receiving and being influenced by light, if you're wondering, this enzyme. We talked about the mitochondrial activation. Again, it's affecting electron transport, which is how it actually influences ATP production. The signaling we talked about before, if you want to be more precise based on the research, releasing nitric oxide, and also affecting reactive oxygen species, which is their signaling molecules inside the cells, and also affecting calcium, triggering cellular responses. Calcium is involved with just about everything when you talk about especially signaling, so especially between the nerve structures, tissues that make up the nervous system or neurons. And so we talked about the therapeutic effects of all that. Okay. There is over 5,000 studies. It's one of the more comprehensively researched modalities out there. So I just wanted to point out that while there is a lot of great therapeutic devices and equipment and modalities out there in the alternative health space, most do not have anywhere near this amount of studies. So when you're thinking about what should I invest in, right, that I know has really solid proven effects and we know exactly how it works, this is amongst the top. So if you're like, oh, I want to invest $10,000 in something, but I really want to make sure, you get the idea, right? Again, there's not many things that are close to this or even remotely close to this many studies. Okay, so it's over 5,000, and a good chunk of it is peer reviewed as well. And they've looked at, if we want to talk about just things related to dementia, around 800 neurology studies, so related to the brain and nervous system. Cardiovascular is also important to mention because that's heavily involved with dementia, especially if it's more vascular. 600 plus, these are actually all melodics are appropriate too, because obviously, well, I should just clarify that again, the cellular mechanisms that are affected, the photochemical response, in other words, that photochemical response is pretty much nearly identical in, you know, the cells of your arm to the cells in your brain. So, moving on, cognitive function, and this is basically the key meta-analysis findings amongst everything I just mentioned prior. And that the simple conclusions: cognitive function, significant improvement in working memory, executive function, 30 to 50% increase in ATP production in human clinical trials. By the way, I just want to mention that this is great for anywhere in your body, and extremely significant compared to other things that affect ATP. Okay, but in the brain, this is the most important because the brain is the most dominant heavy user of ATP. So even if you are chronically low, about 1 to 2%, too low than optimal in ATP production for the brain, even 1 to 2%, especially over years, you will actually most of the time feel, and the feeling of it and notice it, and it could be quite significant, even that marginal low. Now, if you have like a 1 to 2% drop, or 5% even, or whatever, in your legs, unless you're like an elite athlete, you're not going to notice that. And you might just think like, oh, I'm just getting older, I'm 45 now, I'm 65, whatever. That's kind of usually where it's like more of a thing, right? But if you have like a small drop in production in your brain, it's a big deal, and it has a cumulative effect, especially. So this is pretty crazy, these stats. So this is just another way you can think about like, is it better to invest in photobiomodulation or this other modality? So you can literally then go and look at another modality and say, oh, well, it also affects ATP production, but it's only like 15% or 5% or whatever. You get what I mean? And that's just the beginnings of how you can figure out what's a priority to invest in. Okay, inflammation reduction in a wide variety of markers across many tissue types. It's a little unusual based on how wide the reduction is, meaning how diverse the various inflammatory markers are that it affects and influences. It is also generally one of the safest modalities. Hydrogen is also the safest, but this is right there, extremely close to being one of the safest things you could do. Okay, if you have a high-powered laser and you like tied somebody down and try to burn a hole in their arm, yeah, in that scenario, for sure, that could be an issue, but obviously that like never really happens. The only other thing where you see like safety issues with photobiomodulation is with lasers and shining in somebody's eyes if they're not wearing eye protection. And sometimes, those accidents do rarely happen, but they do happen, and that's actually where they have the FDA clearances, like class 3, class 4. It's actually related to how much energy is possible to pass through the diameter of the pupil of the eye. It's based on those specific safety guidelines. That's where they really are. That's what those classifications are for when it comes to lasers. It is related to LEDs too, but LEDs are generally more safe for eyes because they're an incoherent beam versus a laser's beam, just if you were wondering. So if some people have some eye sensitivities, like they have dementia, maybe they have a little macular or their cataract, or they have some other like things where their eyes are more sensitive, maybe the traumatic brain injury they had in the past, right? Then you might want to put some glasses on them if you're treating their face or their neck or their head or something where you might be getting some light into the eyes with LEDs, which is normally fine, it's normally safe, but you might want to put some glasses on them just because they might be more sensitive to that light. Okay, so again, here's a nice little fun diagram. So this part of the brain, motor cortex, we've seen some awesome studies, neurology studies related to photobiomodulation. It affects also in the conditions of degenerative brain injuries, different sorts of mental conditions, Gulf War illness, and actually I just want to throw in just also other people that are been in wars or shooting high concussive injuries from blasts or shooting high-powered weapons. They have a lot of CTIs. Photobiomodulation is appropriate for those areas of the brain that also gets affected. So In those conditions, the most commonly used is a helmet or a localized helmet. But I want to point out, if you get enough energy into the rest of the body, all those beneficial signaling cascades and compounds that end up in your circulatory system, you get a massive amount circulating in the body. And where do you think that circulation ends up? In the brain. So if you were like, oh, I just want to focus on cognitive or brain related things, localized, okay, yeah, absolutely. Go for something more localized for the brain, or something that's very strong that you can use around the neck and the face and the gut, maybe. But, however, do not underestimate putting a huge amount of joules of energy into the rest of the body for enough of a duration, because that also powerfully goes up into the brain. And I don't think there's been any studies, unfortunately, yet comparing getting a lot of dosage time, a lot of joules of energy into the body systemically, compared to like using maybe a transcranial photobiomodulation helmet or something directly for the brain, the scalp, or even inside the nose. There hasn't been any studies comparing the two, but I know enough about the research and like what happens systemically to tell you that, in my opinion, a person's probably going to get more efficacy treating their whole body with a lot of energy versus using just a helmet on the brain. But if you can do both, obviously that's ideal, right? If you can do, something on the brain directly, which you can also use a laser, high-powered laser for, by the way, but something, on the brain directly and whole body, I mean, that's an ideal world scenario, just to be clear, okay? Also, photobiomodulation studies have looked at the prefrontal cortex, and again, these types of conditions here: physiological, mental, brain injuries, sexual dysfunction, drug abuse, ADHD. There's like a lot. There's really actually a bigger list here, obviously, of things that are related to the prefrontal and executive centers. Okay, in this scenario, in a lot of studies, this is true. They've generally used lasers, because you can just take a laser, high-powered laser, or a low level too, and put it directly to the forehead. There's also a very high-powered LED handheld device with the company I deal with that's a little unusual, and that one put out 20,000 milliwatts. There's a 10,000, there's a 20,000. If you have any questions about that one, it's perfect though, and they use that right directly on the forehead. And it's actually been in some of the studies, or worked with some of the authors that have worked in the studies with Harvard with the high-powered LEDs on cognitive conditions. That's a great device for that, and you can put it on the sides of the neck. You put it on the sides of the neck, you put it on the frontal cortex, and then you put it on the gut, actually, and with red and near infrared, and that's fantastic for brain-related conditions, especially near the front. Now, even though it's going in the front, which, by the way, the forehead's a little bit thinner than the bones in this part of the brain, just FYI. So that's why there is a lot of laser studies pointed, and LEDs pointed on the forehead, because, and there's more so there for trying to affect the rest of the brain, because again, the bone is a little bit thinner in the forehead, if you were wondering. That's the main reason. It's not just because there's like a bias towards the frontal cortex or anything like that. It's just more convenient, okay, than like shining a bunch of laser diodes with some whole setup on all these different other parts of the brain and stuff like that. So all right, so a lot of different cardiovascular benefits, and again, you can pause and kind of just take a glance at the diagrams over here. So clinical evidence has pointed out it can reduce blood pressure, has multiple effects on endothelial functions, enhanced vasodilation, nitric oxide production, better blood flow then of course happens, cerebral perfusion basically, which is so important. There's so many contributing factors, I will just tell you, to things that reduce cerebral circulation, okay? So that's just another thing to go down a rabbit hole with, is what things are affecting it. One common condition we see nowadays, even with young people who have been on technology since they have been a little bit younger, like their phones and computers, you see this man's head here, is the jutting forward of the head, where the neck is losing its proper curve and it's jutting forward, hanging forward more. And usually used to see that with like older folks. Now you're seeing it with a lot of younger folks. So don't forget to correct the cervical area, especially if, of course, there's been like an injury or an accident in this area. But basically that drastically reduces blood flow and lymphatic or glymphatic clearing, when there's a loss in cervical posture. So that's crucial. So you might want to pair that with photobiomodulation, and you'll get like significantly better results. Also, sleeping at an angle or an incline in one's bed can also enhance photobiomodulation, again related to brain conditions, not just dementia. So again, when you dive into like different sorts of therapeutic approaches to improve endothelial function, you won't find that much actually. There are lifestyle factors and stuff like that. There's supplements, and those can be really fantastic, don't get me wrong, on endothelial. But there's not like a lot of other types of therapeutic modalities that are affecting endothelial cells and even deeper than that in a very systemic way all at the same time, like photobiomodulation. So if you improve endothelial function and you improve your vascular system, obviously we can conclude that it will affect every other health condition, right? So all your organs are dependent on a really optimized cardiovascular system, right? So again, when you dive into the research, you're like, oh my gosh, it does all this amazing stuff on these functions. There really is a lot to chew on. Okay, so 2024 meta-analysis of 18 studies found that photobiomodulation statistically reduced blood pressure compared with some pharmaceutical interventions with no side effects. Okay, and again, these other things, got to bring that in here as well. Nitric oxide is a big one that became super trendy in the last 5-10 years. Supplementation diet's always important, exercise obviously, but not everybody can exercise, right? Especially in more optimal ways. Okay, so then you have to look for other options. And again, there's not a lot. I know a few, but there's not a lot of modalities that really can do a significant uptake. And look up the mechanism of how it happens, but it is quite fascinating how it actually leads to an increase in the good type of nitric oxide. Just want to be clear, the good type of nitric oxide that we want, and actually modulating the, let's just call it the nitric oxide. So a lot of people just say nitric oxide. Doesn't mean like it's just an all-in-all good thing. There's several molecules of it, and some that if they're excessive is not good for you. So just want to clarify. All right, physical activity and muscular health does a whole bunch of stuff. I won't get into this too much because we're really, supposed to be talking about dementia. Okay. So moving on. The only thing I will say though is obviously a lot of times, what leads up to cognitive disorders, or it could be accidents, trauma, whatever. A lot of times that individual, for many reasons, is not like a gym rat, or doing a bunch of different outdoor activities where they're like really getting in a solid amount of really good, like the good kind of exercise. That a lot of times, right, goes hand in hand. Individuals maybe just not moving as much. And so this is actually like a mega problem, right? Not moving as much. So you got to also think about, for these individuals, what types of modalities can compensate and perhaps mimic some of the benefits, or if not exactly, that we see that come from exercise and movement. Is that possible? I can tell you absolutely. After a lot of research, absolutely. There are a few modalities you can stack together and they will mimic and even outperform certain metabolic responses and markers that certain types of exercise produce. Exercise is an amazing, amazing thing to do. It's still one of the best longevity, anti-aging things. But I can tell you there are a few things, if you stack together, even 2-3 things, it significantly reduces the side effects, of which there's many, to not getting enough exercise or movement, which is super bad. That's real bad. If somebody's laid up in a hospital bed, you can look up this statistic again, but I think if somebody's laid up in a hospital bed for like a couple weeks, it's something like ages the mitochondria of the body. Like I couldn't even remember what the stat was. It was unfreaking believable. It makes you like an old person like that. It's like one of the worst things is to just be laying around. Now, it's not like you can't get that function back again with the right protocol within a few months, but it significantly ages the body to be laying around and sitting around. So just wanted to point that out. All right, sleep quality, circadian rhythm is extremely important when it comes to preventing cognitive conditions and honestly just about improving any aspect of your life, really. When you go, this is a massive rabbit hole to go down, so be careful. So photobiomodulation is a huge asset when it comes to regulating circadian rhythms. and improving sleep quality without suppressing melatonin production. Okay, so there are certain structures which they're talked about in here. The suprachiasmatic nucleus, that's what it stands for, that regulates your all kinds of metabolic functions in the body through the autonomic neuroendocrine systems and everything. Affect all the organs. It's super complex, and that all those different things, like, you know, process in different ways during different phases of your sleep. You know, it's not like, oh, I went to bed. It's so simple. It's like, oh my gosh, no. What happens when you're sleeping? There's so many different phases and functions, and so if some of those are not, you know, are affected or disturbed because of this or that, then over years and years and years, you think you're sleeping well, but really you're heading towards decline. I mean, oh my God, it's a headache. It's a lot to get into. Okay. And even just breaking apart this diagram alone, yes, you can see there's a lot happening here. And the short answer is red light and near-infrared timed, if you use it at certain parts of the day, has several effects. Your sleep architecture, your circadian alignment. It can help you get back on appropriate rhythms. Part of it is the visual stimulation of red light that signals certain parts of your eye, just like blue light affects certain parts of your eye. Near infrared also, actually, even though you can't see it, does also affect the same receptors in that same area of your eye, because we get near infrared and red from the sun, right? It's related to the sun, okay? And you can artificially produce that different times of the day, but also just systemically getting it into your body also affects intracellular melatonin in your cells, and affects other signaling mechanisms that also is related to this super complex neuroendocrine metabolic circadian process, to not get into it. But there's a lot of studies talking about how it can improve sleep onset latency by 37%, crazy. And remember that these aren't long-term studies, so things can actually continue to cumulatively improve a little bit beyond this, okay? Increases REM sleep by at least 14%. Some people got more than that. And again, it was in a short window of time. It could improve, especially if you start to cut out blue light with blue light blocking glasses and you stack a few things together, you could significantly improve this factor, which is no joke. That's a lot of extra REM. Reducing nighttime awakenings, okay? Or we call that like fractionalization of your sleep phase, certain deep sleep phases, okay? But either way, there's a lot of research on sleep quality related to cognitive disorders and preventing dementia, also just actually trying to reverse certain stages of cognitive dysfunctions. So certain stages of dementia and Alzheimer's, you absolutely can reduce and back out completely. It does, depending on what stage you're at, you have to get more and more fancy, and you have to spend more and more money, just to be honest. But I will just tell you this, that there are, like Bredesen protocol out there is pretty advanced. And there's a few others, but they only handle up to certain stages, and there's some limitations with some of the best protocols out there. If you want to get like really above and beyond, you have to factor in certain very highly specialized modalities, therapeutics that you can invest in, and you usually have to get involved with biologics, specifically ideally exosomes, and put those exosomes into the brain. And just a sidebar comment, most exosomes that are sold and that practitioners use are not what they think, because the testing methods for proving what's in there is flawed fundamentally. So if you disagree and you're a practitioner, I can promise you I can prove that, and you will be very frustrated and upset, because you also put some people at risk potentially. And there is one manufacturer that has proper testing methods, to put it simply, and that is Chimera Labs. So those can be a game changer. It's not mainstream talked about, but if you put those and you stack it with photobiomodulation and lifestyle changes and other modalities, you can do things that absolutely look miraculous, completely miraculous. And that's for different sorts of brain diseases and brain conditions. Things that most practitioners would say, nah, it's impossible. You're never gonna help them, or if you do help them, it's gonna be extremely marginal. And these people can come back from the dead practically, and like nothing happened. I mean, it takes a lot, it really does, and not every case can be super miraculous, but a significant percentage of them can. So moving on, if you have any questions about all that, by the way, I'm your guy. Just reach out, email me. In the description box below, you can find my email. Chronic pain is actually a risk factor for dementia. Okay, affecting sleep quality, mood, physical activity, and stress. Obviously, right? We don't think about how pain affects all these things. But stress, just being stressed all the time, is like the worst thing ever outside of not sleeping well, and or eating terrible food. All these things are some of the most debilitating cumulatively over time. Okay, so really impressive studies on how it modulates pain. Okay, overall meta studies, 70% reduction in pain medication use. Because remember, there's side effects obviously to using certain pain meds, especially on the gut, which then of course has some of the worst effects, right, on the brain when your gut declines. So much of these conditions and many others really actually start in the gut, at least a significant contributing factor. Obviously, there's a lot of exceptions to that, but you always have to optimize your gut in as many ways as you can. 2 to 3 times faster healing in chronic wounds. That might be contributing to pain, just to be clear. It's a crazy stat, by the way. It's nothing to gloss over. Like it's literally like, oh my gosh, this should have taken 9 weeks. It took 3 weeks, or this should have taken 3 months. This took 1 month. Like it's like, oh my god, like wow. There's so many studies. It's mind-boggling related to just faster healing, soft tissue injuries, wounds, things like that. This is a broad term, but 30% improvement in physical functions. Meta-analysis should show various pain conditions it treats: arthritis, neuropathic pain, musculoskeletal disorders, and the efficacy rates overall for all these things and more is usually about 60 to 85% in controlled trials. You should be impressed by that. Again, when you start to look at a lot of other things, a lot of other treatments, or mainstream medical, quote, treatments, if you want to call it that, usually most things are not even remotely close to this. Okay. And obviously the mainstream medical way is surgeries and pharmaceuticals, right? Which doesn't actually, it's not really therapy. Cognitive, there's a lot of transcranial, as we've talked about, photobiomodulation. Okay, talking about improving neuronal metabolism, increasing blood flow in the brain, promoting neuroplasticity. Okay. And it's quite fascinating. It may improve memory in Alzheimer's disease through regulation of neural oscillation characteristics. So the cool thing about the last 10 plus years is we've had a lot of improvements in ways to measure different things in the brain, essentially. Brain activity and all kinds of different markers and effects in real time. Once upon a time it was just like an MRI, right? And like a basic QEEG or really like an EEG. Things have really advanced a lot. So as we have these better diagnostic tools and wearables and all kinds of stuff, we've been able to get more fun, interesting data from how photobiomodulation is doing what it's doing. Okay. So again, just put a little pause, and you can see this fun little diagram and just take a little look, kind of see how it's doing what it's doing. Depression and stress affects serotonin and dopamine. Affects your cortisol quite dramatically through the HPA axis. And my gosh, neuroinflammation is related to so many things they're finding these days, but absolutely is related to different mental health conditions, and almost always involved with not just traumatic brain injuries, accidents, but yeah, Alzheimer's, dementia, things like that, Parkinson's, whatever. It's like almost always there. Sometimes it just is a matter, of course, getting the right testing. So if you don't know the right types of lab testing to do, just reach out. So if you haven't done testing on these different things that I have highlighted right here, that would be a place to start, right? Because we definitely got to know, like, what are the contributing factors, right? The other fun part about doing the testing, of course, is once you start doing a certain therapeutic protocol with different modalities like photobiomodulation, you can see how things change. And you'd be like, oh my gosh, this is so cool. Look at my tests, look what happened. And the effects are pretty fast, by the way. You do photobiomodulation correctly, you should see changes in so many different lab panels that are appropriate within as fast as 1 month, few weeks, and seeing more significant things within 2 to 3 months, and really continuing to improve. Now, we aren't really talking about depression, but great stuff for anxiety, mood stability. It affects hippocampal neurons. Anyways, It's important to mention though, like depression and stress and anxiety, because again, that is absolutely a contributing factor to dementia, Alzheimer's, things like that. Okay. The other thing that we look at a lot with brain-related conditions like this is what is going on, like in terms of metabolic disorders, insulin, inflammation that's happening metabolically. So these are kind of all the different signaling pathways. Okay, that is how it's actually affecting our brain. Okay, affecting pancreatic functions, inflammatory markers, HbA1c, blood sugar markers, it's all kinds of stuff. Glycemic control. They've done tests with diabetes, things like that. You've heard some people say like, oh, these brain conditions, they're like diabetes on the brain, and that's why they like ketones and ketone, right? Well, yeah, it's generally true. It's related, and so photobiomodulation, yeah, what it's doing with the insulin aspect of things and metabolism and cellular energy, and it's doing similar things in the brain, if not identical. Influences a lot of different lipid metabolism, healthy weight management. So there's a lot of things it actually does, affecting your cholesterol, improves your liver function. A lot of these trendy tests, right, that people get related to their metabolism, some of their risk markers related to their body composition. There's studies going over how it's improved those markers as well. Again, these are a big deal, even if you're just like, oh, it's a small percentage, or this, that. First off, they're actually more significant changes that we see. Okay, and remember that there's limitations to those studies. So long as you've improved your lifestyle in different ways, being consistent with a modality like this, imagine over a year or 2 years or 3 years, imagine cumulatively, right? It's just like I said, oh, why don't you exercise for 6 weeks or 12 weeks or whatever? And yeah, you'll probably feel better, but it's like, does that mean you quit? Does that mean that if you don't need to exercise anymore, or you couldn't get more health benefits to exercise? Most people really should be exercising for months and months and months and months, and it gets better and better and better and better. If not, they need to exercise for a few years, right, to really get themselves back on track and get more and more health benefits. So it's the same thing with photobiomodulation. So actually, when you look at a lot of these findings on just about any of these things, they're extremely impressive because the windows of when they're evaluating them, timeline-wise, is very small. And you can continue to improve your body systemically in so many ways over longer periods of time with photobiomodulation. So just always keep that in mind. If you're impressed, with the vast amount of studies, again, with short-term results, think about the long-term. So many different pathways related to inflammation and the immune support. And declining immune function, especially as you get older in life, is very well established and looked at and evaluated about the role of the immune system and how that leads to a wide variety of health conditions, including dementia and things like that, and puts you at risk. So there are different ways that photobiomodulation is going to be affecting you, different immune factors. So I'm probably just going to try to wrap up here now that we're probably going on about a little while, 43 minutes. If you're kind of curious what your treatment parameters are, this is more or less about it. Okay. And cumulatively, usually with whether it's laser or whole body, when you're first starting it with yourself or with a client or patient, you're usually wanting to do more loading sessions. So front loading, doing more sessions your first or second, it's usually your first 2 to 3 weeks. And as you do more, then you can start to back off just a little bit and not doing quite as many per week. Okay, so just so you know, it's always a loading phase on the front end, and then you kind of transition to less and less as time goes on. And depending on different types of factors, lifestyle factors especially, other contributing factors, you can figure out long term for like months later. You always want to stick with it to maintain results. Like what's the minimums, to maintain the results. And you can definitely, absolutely, there's enough data out there to make some conclusions about. And you can always ask me, of course, what those guidelines are longer term to keep results. So again, a lot of screens, you want to pause or just download and go take a look at this presentation, which I would recommend you do. You can bounce back to some of these different things. Okay. And here's some of the latest clinical trials as of 2024. But there is a lot. I have some citations, or I should here at the bottom here. And again, this is by no means comprehensive. It's just freaking endless. But I just threw in a few pretty good ones here for different aspects of the body if you just wanted to kind of take a look at those. Let's just scroll here. I'm just kind of going on these different things if you just want to do a quick pause and kind of see what this is. But these slides here are if you are in a wellness business and you're looking to get some guidance on if you want to bring one of these in for people, what that would look like when you first start seeing them, and other things that you would recommend for them as well, to balance things out. This slide got a little garbled here, but I might be able to get you, I think it's cut off, but it does have the 3 different sections for the different domains that are, should be more of a comprehensive protocol. So again, this is not just going to fix something as a standalone. You always want to pair it with some additional modalities and changes and therapeutics and things like that to get the absolute best outcomes possible with photobiomodulation. But that's what that slide's about if you want to integrate it into your business. And I'm always available for consultation on that anytime. I don't charge anything for my consultation. So hopefully you found this somewhat interesting. This is kind of my new style for videos, is kind of going through more presentations. It's challenging when a modality is really information rich, without it sounding tedious to get through all the information. But suffice to say, hopefully this was just enough just to kind of impress you, because if you're not working with photobiomodulation right now, it is just generally one of the better all-around things you can invest in. ROI for just about anything. And again, if you want some guidance on best brands or models or whatever it is, what kind of setup, and then you also are maybe considering other modalities that are synergistic with the complementary, and when you understand the actual cellular mechanisms of each of these, you can actually figure out what goes well together. And that's what I do. So just send me a message anytime. Always happy to answer questions 7 days a week. Thanks for watching. Don't forget to like and subscribe to my video just to help other people see my video. Thanks. Bye.